Chronic otitis media and chronic rhinosinusitis are two of the most prevalent inflammatory conditions in otolaryngology. Despite their common occurrence, the association between these two diseases has not been extensively explored. Both conditions share pathophysiological mechanisms, including bacterial infections, biofilm formation, and persistent obstruction of ventilation pathways. This systematic review aims to analyse the existing literature regarding the relationship between COM and CRS, considering epidemiological data, pathophysiological interactions, and potential treatment implications. The study followed the PRISMA guidelines for systematic reviews. A comprehensive search of Pubmed, Scopus, Web of Science, and Cochrane databases was conducted, covering studies published from 2012 to 2022. The inclusion criteria required studies to focus on patients diagnosed with CRS who also developed COM, with well-documented evaluations and treatment approaches. Studies were assessed using the National Institutes of Health Quality Assessment tool for observational cohort and cross-sectional studies. Out of 2,503 initially identified studies, only 4 met the inclusion criteria. These comprised a total of 20,867 patients diagnosed with CRS, among whom 991 also had COM. 3 of the studies were retrospective, while 1 was prospective. Despite differences in patient selection, all studies suggested a significant association between CRS and COM, supporting the hypothesis of a global inflammatory process affecting both the nasal and middle ear mucosa. The studies predominantly reported on male patients aged between 15 and 85 years. CRS patients were more likely to develop COM if they also had nasal polyps. The prevalence of COM was higher in patients with CRS than in the general population, reinforcing the hypothesis of an underlying link. Patients with both CRS and COM commonly exhibited symptoms such as nasal congestion, hearing loss, ear discharge, and atalgia. One study reported that conductive hearing loss was prevalent in patients with COM, with an average air-bone gap of 21.5 decibels. Radiological evaluations, including CT scans, demonstrated no significant anatomical differences between CRS patients with and without COM. However, microbiological analyses revealed a high degree of bacterial concordance between nasal and middle ear infections, with common pathogens such as Staphylococcus aureus, Pseudomonas aeruginosa, and Streptococcus. The potential mechanisms linking CRS and COM include eustachian tube dysfunction caused by nasal inflammation, structural anomalies such as septal deviation or concha bullosa, and shared immunological responses. Chronic inflammation in CRS patients may extend to the middle ear, predisposing individuals to recurrent infections and prolonged mucosal damage. These findings suggest that COM is not merely a complication of CRS, but may represent a broader inflammatory disorder affecting the upper respiratory tract. This systematic review highlights a strong association between CRS and COM, emphasizing the need for otolaryngologists to assess both conditions in patients presenting with persistent sinonasal or otologic symptoms. Early diagnosis and integrated management strategies may improve patient outcomes. Future research should focus on prospective studies to establish a causal relationship and explore targeted treatment approaches, including novel anti-inflammatory therapies and biologics.